I have the miniature replica of a human skeleton. I'm going to name some of the bones on the skeleton. We'll start out with the skull. We have the frontal bone, which has the squamous part of the frontal bone, and also the glabella, right there. And there's a frontonasal suture right here in this area. Also a supraorbital foramen on each side above the eye sockets. The supraorbital margin is this area. There's a superior orbital fissure on the inside. Also, you can see the optic canal. The inferior orbital fissure on the bottom is also noticed in the eye socket. The nasal bones right here. Also, we have the sphenoid bone, which you can see on the inside there. The ethmoid bone also is seen right here on the inside, and inside of the nose we have the middle nasal concha and the perpendicular plate. Now the middle nasal concha are these ones on the top. The perpendicular plate is the top part of the bone in the middle, and that makes up the ethmoid bone as well. The inferior nasal concha is the ones down here on the bottom, and also we have the vomer that's on the bottom part of that. The maxilla is here, and this is the mandible. Also have the mental foramen, the infraorbital foramen are right here below the eye sockets. We also have the temporal bones over here on the side, right here, and then the occipital bone, which is back here. The parietal bones are here on each side. We have the coronal suture, which separates the frontal bone and the parietal bones on each side. We also have the occipitomastoid suture, which separates the occipital bone and the mastoid part of the temporal bone. Here you can also see the zygomatic bone right here on the side. We have the mandibular condyle, which on the back right here of the mandible. Also the mandibular notch is right there. And the coronoid process is on the front part of this mandible. This is called the mandibular ramus, and the mandibular angle right here. Also we have the alveolar margins on the top right here of the maxilla above the teeth, and then below the teeth down here on the mandible. We have, if you go a little further down, we also see the sternum here. We have the clavicle bone as well, which we have the sternal side of the clavicle bone and the acromion side where it attaches to the acromion process of the scapula. Right here we have the we have the jugular notch on the top portion of that of the sternum. We also have the manubrium here, the body of the sternum here. This is the xyphosternal joint and also the xiphoid process at this area. You can also see the rib cage. Here we have the the costal margin here. We have the intercostal spaces. We also have the ribs. If you look, the first 7 ribs are also known as the true ribs. Then the 8 through 12 are known as the false ribs. Down here we have number 11 and 12, which are the floating ribs. Let's see, on the back side, we'll go to the clavicle, or to the scapula, I'm sorry. We have the scapula right here. The acromion process, again, is right here on the side. The glenoid cavity is over here where the head of the humerus attaches. Here we have the spinous fossa. And this is the spine of the scapula. We have the suprascapular notch here, and on the front part you can see the coronoid process sticking off right there, or the coracoid process, I'm sorry, sticking off right there. Also we have the infraspinous fossa. We have the lateral and the medial borders of the scapula. We also have this inferior angle of the scapula. And the superior angle is right up here. Let's see, while we're back here, we have the vertebrae. The first 7 vertebrae are referred to as the cervical vertebrae. The next 12 are referred to as the thoracic vertebrae. And then we have the next 5, which are the lumbar vertebrae. We also have the sacrum here, and the coccyx, which is here. We have, on the first 2 cervical vertebrae, there's the dens of the axis, which C1, the first cervical, is known as the axis, and the second cervical is known as the atlas of the cervical vertebrae. Let's see, we'll go to the humerus, name some of the parts of the humerus. We have the humerus bone. There we have the greater tubercle, the lesser tubercle. We have the intertubercular sulcus. We also have the head of the humerus. There is an anatomical neck. This here is considered the cervical neck. The deltoid tuberosity. We also have the lateral supracondylar ridge. We have the radial fossa, the coronoid fossa, and the olecranon fossa is on this side, which attaches to the ulna, where the olecranon, or elbow, right here, olecranon process. We have the medial condyle of the humerus here, and the lateral epicondyle here. On the radius, we have the head located here. This is the neck of the radius, and this is the radius bone. Also on the ulna bone here, and then we see the bones of the hands, the phalanges, all the wrist bones. Let's see. We also have the leg bone. We have the femur. We have the head of the femur located here. The neck of the femur is here. There's the lesser trochanter. There's an intertrochanteric